purpose of the video is to standardize transfer process from EMS to RDHW ED staff to avoid chaos and have an organized process to transfer the care and do it quickly and safely.
Riverside Doctors, Williamsburg Medic 10, this is Israel. How do you copy?
This is Doctors Hospital. Go ahead with your report.
Good morning, Riverside. This is Williamsburg Medic 10, currently en route to your facility with about a 6-minute ETA. Coming to you with a 72-year-old male from Riverside Nursing Home. Do you have any questions or orders?
No questions, no orders. Trauma 1 on arrival. Please advise of any change in patient condition en route. Doctors clear on the here. This is Victoria Doctors Hospital. We have a critical alert coming to Trauma 1 in the ER.
Third objective is the process by which we set the room, mobilize the team for imaging, lab, our primary nurse, our secondary nurse, our medic, and the role of the physician in the room to receive the report. The staging of the room is to allow the primary nurse and the physician to do an assessment of the patient working from the patient's right side, and those individuals who need to complete tasks to care for the patient are working from the patient's left side. Staging of radiology and laboratory is outside the room, and then registration is outside the room to get any information from the patient so that they can execute a chart. Transfer respiratory airway equipment first to our respiratory therapist, move the patient from the EMS stretcher to the Riverside Doctors Hospital stretcher, and then transfer additional patient care monitoring equipment over to the RDHW staffs. And get the stretcher out of the room so that the physician and primary nurse can do an assessment. After the patient is transferred, a timeout will be called by the physician where there'll be no talking in the room. Patient care report will be presented by the EMS provider, attendant in charge. All right, now that he's on the monitor, I'd like EMS to give us a report. I'd like a timeout in the room, please.
Okay, this is Mr. French. He is from River Dent Nursing Home. Staff there stated that he became altered this morning. They noticed he was having a little bit of trouble breathing and also did have a fever. On our arrival, he was in some pretty moderate respiratory distress. We put him on the monitor. He was sat in at about 76% on room air, respiratory rate of about 30. On the monitor, he was sinus tach at a rate of 130, does have a temperature of 101.1. Blood sugar and a 12 lead were normal. We established an IV, given him a little bit of fluids. He was initially hypotensive, and we've gotten that up a little bit. And with the CPAP, we were able to bring his saturation up to 89%.
Okay, great. All right, Avis will keep him on the CPAP. Let's get a gas, and we'll start our sepsis protocol. The physician's role is to initiate care plan, communicate that with the primary nurse, who will place orders and direct her staff to perform those tasks that are needed to care for the patient. All right, guys, still pretty lot of Ronchi bilaterally. Let's keep them on the CPAP. We'll get the gas like I stated. It's still a little clammy, so let's make sure we start the sepsis protocol. I need a second IV, and let's start that fluid resuscitation per protocol.
Okay.